Hi everyone! Welcome back to English Fab, where learning English is practical, useful, and fab. Today, we're focusing on a very important topic, hospital and medical vocabulary. Whether you're traveling abroad, visiting a doctor, or dealing with a medical emergency, knowing the right words can make a huge difference. Many learners struggle with medical terms because they can be long, complex, and difficult to pronounce. Plus, in a hospital setting, things move fast and you need to understand what's happening right away. That's why in this lesson, we'll go over essential vocabulary related to hospitals, including medical staff, equipment, treatments, common illnesses, and emergency situations. This vocabulary follows our English Fab website, where you can find more useful learning materials. If you find English difficult, don't worry. You can translate the subtitles into English in your own language like this. Check the description below for extra details. Now let's get started. Let's go over some essential vocabulary. 1. Medical staff in hospital departments. Doctor, a medical professional who diagnoses and treats patients. Nurse, a healthcare worker who assists doctors and takes care of patients. Surgeon, a doctor who performs operations. Paramedic, a medical worker who provides emergency care before reaching the hospital. Anesthesiologist, a specialist who administers anesthesia before surgery. Radiologist, a doctor who uses medical imaging like X-rays and MRIs to diagnose diseases. Pediatrician, a doctor who specializes in treating children. Cardiologist, a doctor who treats heart-related conditions. Emergency room, a hospital department for urgent medical care. Intensive care unit, a specialized section for critically ill patients. Maternity ward, the department where women give birth and newborns receive care. Surgery room, a dedicated area for performing medical operations. Pharmacy, a place where prescription medications are prepared and dispensed. Rehabilitation center, a facility where patients recover through therapy. Waiting area, a space where patients and visitors wait before seeing a doctor. 2. Hospital equipment and facilities. A hospital bed, a special bed designed for patients in hospitals. Wheelchair, a chair with wheels used for people who have difficulty walking. Stretcher, a flat mobile bed used to transport patients. IV drip, a method of delivering fluids or medicine directly into a patient's veins. Oxygen mask, a mask that provides oxygen to help a patient breathe. Blood pressure monitor, a device used to measure blood pressure. Defibrillator, a machine that delivers an electric shock to restart the heart. Heart rate monitor, a device that tracks the heartbeat. Ventilator, a machine that helps patients breathe when they cannot do so on their own. Syringe, a small tube with a needle used for injections. Medical chart, a document that contains a patient's medical history and records. Bandages, a material used to cover and protect wounds. Cast, a hard covering used to protect broken bones while they heal. Crutches, walking aids for people with leg injuries. Thermometer, a device used to measure body temperature. 3. Medical procedures and treatments. Surgery, a medical procedure that involves cutting the body to repair damage or remove disease. X-ray, a scan that creates images of bones and internal organs. MRI scan, a detailed imaging test that uses magnetic fields to examine the body. Blood test, a medical test that examines a sample of blood. Vaccination, an injection that protects against diseases. Physical therapy, exercises and treatments that help people recover movement and strength. Chemotherapy, a treatment for cancer that uses powerful drugs. Dialysis, a medical procedure that removes waste from the blood when the kidneys fail. Injection, the process of administering medicine using a syringe. Prescription, a written order from a doctor for medicine. Stitches, thread used to close a deep cut or wound. Ultrasound, a scan that uses sound waves to create images of the body, often used for pregnancy. Anesthesia, medicine that numbs the body or puts a patient to sleep before surgery. Wound dressing, a protective covering applied to a wound. Cast removal, the process of taking off a cast once a broken bone has healed. 4. Common illnesses and conditions. Flu, a common viral infection that causes fever, cough, and body aches. Cold, a mild viral infection that affects the nose and throat. Fever, a higher than normal body temperature, often a sign of infection. Infection, a condition caused by bacteria, viruses, or fungi. Allergy, a reaction to substances like pollen, dust, or food. Broken bone, a fracture or crack in a bone. Headache, pain in the head, often caused by stress or illness. Stomachache, pain or discomfort in the stomach. Cough, a reflex that clears the throat and lungs. High blood pressure, a condition where blood pressure is consistently too high. Diabetes, a disease that affects blood sugar levels. Asthma, a condition that makes breathing difficult due to swollen airways. Food poisoning, illness caused by eating contaminated food. Heart attack, a medical emergency caused by blocked blood flow to the heart. Stroke, a serious condition where blood flow to the brain is interrupted. 5. Emergency situations and responses. Ambulance, a vehicle used to transport patients to the hospital. CPR, cardiopulmonary resuscitation, a life-saving technique used when someone stops breathing. First aid, immediate medical care given before professional help arrives. Emergency surgery, a life-saving operation performed in urgent situations. Unconscious, a state where a person is not awake or aware. Choking, a dangerous situation where something blocks the airway. Breathing difficulties, trouble inhaling or exhaling properly. Severe bleeding, excessive loss of blood from a wound. Fracture, a break in a bone. Poisoning, harmful effects caused by swallowing or coming into contact with toxic substances. Heart failure, a condition where the heart is unable to pump blood properly. Seizure, a sudden uncontrolled electrical disturbance in the brain. Trauma, a serious injury caused by an accident or impact. Panic attack, a sudden episode of intense fear or anxiety. 911 call, a call made to emergency services for immediate help. Now that we've gone over essential vocabulary, let's see how these words are used in real-life sentences. These examples will help you understand how to use them naturally in conversation. 1. Medical staff in hospital departments. The doctor examined the patient and prescribed some medicine. A doctor's job is to check a patient's condition and decide on the right treatment, which often includes prescribing medicine. She was taken to the emergency room after a severe allergic reaction. The emergency room is where urgent medical cases are treated, such as life-threatening allergic reactions. 2. Hospital equipment and facilities. The nurse adjusted the patient's IV drip to control the fluid levels. IV drips are used to deliver fluids or medicine directly into the bloodstream, and nurses monitor them to ensure the patient gets the right amount. He was moved to a wheelchair after surgery. Patients who cannot walk, especially after surgery, are often transported in wheelchairs to avoid strain on their bodies. 3. Medical procedures and treatments. The X-ray showed that he had a broken rib. An X-ray is a medical imaging technique that helps doctors identify bone fractures or other internal injuries. She received an injection to relieve the pain. Injections are commonly used to deliver medicine quickly, especially for pain relief or vaccinations. 4. Common illnesses and conditions. He stayed home because he had a high fever and a bad cough. Fever and cough are common symptoms of illnesses like the flu, and staying home helps prevent spreading germs. She was diagnosed with asthma and given an inhaler. Asthma is a respiratory condition, and inhalers help patients breathe more easily by opening their airways. 5. Emergency situations and responses. The paramedics performed CPR until the ambulance arrived. CPR is an emergency procedure used to keep someone alive by maintaining blood flow and breathing until professional medical help arrives. He suffered a severe bleeding injury and needed immediate first aid. First aid is the immediate medical care given to a person before they receive full medical treatment, especially in cases of severe bleeding or injury. That's it for today's lesson. Now you've learned important hospital and medical vocabulary that can help you in real-life situations. Whether you're visiting a doctor, talking to medical staff, or handling an emergency, knowing these words will make communication much easier. If some of these words were new or difficult for you, don't worry. Keep practicing, review the vocabulary, and try using them in your conversations. The more you practice, the more natural they will feel. If you want to learn more, check out our other lessons on English Fab, where we cover practical vocabulary for different situations. Okay, thanks for watching today's lesson on English Fab. I hope you found these English tips useful and feel more confident. Remember, practice makes perfect, so try using these phrases in your daily conversations. If you enjoyed this video, don't forget to give it a thumbs up, share it with your friends, and subscribe for more Fab English lessons. Until next time, keep practicing and stay Fab.